This is One-on-One. I want to introduce you to one of the nation's top experts and leaders in the field of healthcare, Barry Ostrowsky, President and CEO of Barnabas Health. Good to see you, Barry.
Good to see you. Thanks.
We got a good agenda, big agenda here. We'll talk about the fact that for the second year in a row, you are very much involved as the chair of the Lupus Walk, which, as we do this program in a couple of days, May 18th, there's going to be a big Lupus Walk. I'll talk big picture healthcare as well, but even though the show will be seen after Lupus Walk, put up the website, why is it so important?
I think healthcare is dependent on scientific research, and one of the unique aspects of the Alliance for Lupus Research is that 100% of the money that's raised goes into research. It has a particularly strong benefactor in Woody Johnson, and so every dollar we raise of the Jets, so every dollar that we raise, we're able to actually make sure goes into finding a cure, or at least making the condition of lupus better. It's a magnificent event. Our entire system has embraced it. We have teams of walkers throughout the state come with Barnabas Health colors. And so we think it's an obligation on our part, not simply to treat the sick, but to find ways to contribute so that people won't get sick. And ALR, in this particular case, is a wonderful organization, gives us that opportunity.
For those who do not know the Barnabas Health system, I don't need to say full disclosure because you see Barnabas Health, one of the major underwriters of our series. And we've done a lot of work together over the years. Describe what Barnabas Health is.
It's an integrated healthcare system. It has 6 general acute care hospitals, a psychiatric hospital, 2 children's hospitals, a series of outpatient locations, and more than 4,600 physicians affiliated with it. And so we're statewide for the most part, and we are the state's largest integrated healthcare delivery system. We're the second largest private employer in the state of New Jersey. And so we find that we have a variety of obligations. Help the sick, try to keep people healthy so they don't get sick, be economic engines to the state, so that we're very proud of what we've accomplished, and frankly, we're looking at getting bigger in the days to come, and so I think that'll be great.
It's interesting, Barry, is we've been part of a lot of offline or off the air conversations, forums, community forums. That I've moderated, facilitated with you there, with a lot of tough questions being asked of community leaders, political leaders. A lot of folks in the community who want to know, with national health care laws changing in January of 2014, and things changing as we speak, what things are going to look like. Question, the two biggest challenges you say your system faces and the overall health care system faces over the next 12 to 18 months would be?
I think the biggest challenge we all face is how do you balance resource allocation with healthcare delivery? We all know that healthcare is complicated. We all know that we want the best in quality in healthcare, and we want it given to us as quickly as we need it. But that takes an awful lot of resources. And quite frankly, how do we find the resources? How do we make sure the resources are spent efficiently? And is there an ability to make the healthcare delivery system more effective for its practitioners and for its consumers?
Stay on that for a second. Give us a concrete example as to the kind of realistic, excuse me, challenge that a healthcare system would face. Like, we'd like to do this for the patient, but we're dealing with this economic reality.
Well, it starts with the fact that healthcare as an industry was way behind in informational technology. We always used to say that you could call 3 minutes after the stock market closed and understand the price of every stock that's traded. In healthcare, we collect millions of pieces of data, but it takes a long time to collate them, and quite frankly, it takes a long time to be able to use them to diagnose and treat a patient. So we've spent hundreds of millions of dollars just trying to catch up on information technology. If one of the challenges we have, as we believe it is the case, to coordinate the care better, that means everybody has to be able to communicate with one another quickly and effectively, and we don't have that yet in healthcare. So it delays diagnosis, it delays treatment, it frustrates patients. That's the kind of thing that we face. Now, how you make it seamless and how you make it more efficient and how you make it more coordinated is in fact the great challenge that we're all going to face. And can you spend the resources necessary to get the system to that point? I think that's going to be the puzzle we're going to have to solve.
As we approach January 2014, because I think a lot about communication, and I talk to you a lot about communication and getting information to people's hands in a way that makes sense. How confusing do you think it's going to be for the average consumer in New Jersey, and we're seeing it in a lot of states, but just deal with New Jersey for a second, when it comes to the exchange process where people are going to all of a sudden have health insurance available to them? Federal government's going to handle the health exchange operation because the governor made a decision about that. Feds will handle it. Am I making too much of it that's going to be confusing to people?
No, I don't think you are. You're an expert on communications, and you're an expert on looking at trends among retailing and how that interfaces with the population. This big change for healthcare is going from a wholesale mentality to a retail mentality. Frankly, I don't think it really makes a difference who's hosting the exchange or who's supporting it, whether it's state or federal. The question is, how do you communicate with a prospective buyer who's used to getting health care through his or her employee or directly from the government? Now this individual is going to have to sit down and make critical decisions about what he or she is going to expect in health care coverage. That conversion from a more wholesale mentality to a retail mentality is something, quite frankly, that institutional health care has been trying to sort out over the last number of years, but we're now at an accelerated pace.
You have to do it.
We have to do it. And truthfully, you know, healthcare is full of all kinds of acronyms and a lot of scientific jargon. And sitting down with a consumer and saying, we need you to try to make some decisions about healthcare coverage is a very scary notion. I don't think many of us, if we weren't in the business, I wouldn't look forward to sitting down and trying to make that decision. That's where the communication is going to be important. That's where the complicated jargon is going to have to be simplified. And there are many of us who believe that this conversion is necessary if it's appropriately supported. Left to everyone's own devices, it's going to be somewhat petrifying to most people.
It's a big, we're going to play a big part in that as well. Shifting gears, the other interesting initiative that I want to put on the table, the 2014 Special Olympics USA. Barnabas is very much a part of that. We're part of it with our friend TJ Nelligan and some of the other folks that are doing a great job there. What is it? Why is it so important? And why should we care?
Well, we are so excited about this, Steve. I don't think we've ever announced an initiative in our organization that's been embraced with the same level of enthusiasm as our sponsorship of the Special Olympics USA in 2014. You know, we pride ourselves about being community representatives, community citizens, helping to cure the sick and support families. And sometimes we overlook constituencies within the population that have a great need for organizations like ours and others, and the Special Olympics to come to New Jersey as a nationwide event. We thought it was precisely consistent with our mission. These are young athletes who have families, who have been dealing with challenges that frankly many of us don't know. And we Barnabas Health should play a major role in that. And when the opportunity presented itself, we immediately jumped at it. So we're excited about being a presenting sponsor of that. We're excited about a special program for the first time that's going to happen in these Olympics, where the youngest of Special Olympians are going to be trained ages 2 to 7 before they qualify for the National Olympics. We're going to be hosts to their families. This is about healthcare workers and Barnabas Health integrating with people who truly appreciate support when given. It's going to be a great time for the state of New Jersey. I mean, we have 3,500 athletes participating, 10,000 volunteers, probably 50,000 people who will be attending these games throughout New Jersey. And so to have Barnabas Health connected to such a wonderful event and the pride of New Jersey, and to support these athletes and families, I tell you, I can't say enough about it. I'm so excited.
That's why we're excited as well, which is why we were putting up the website for the 2014 Special Olympics USA. We'll be providing coverage of that. We'll be encouraging people to volunteer. It's an important event. Next time we talk to Barry Ostrowsky, we'll be talking more about prevention and wellness, a big, important topic. Quote that Barry likes to use is, life is better, healthy.
It is.
It is. Listen, Barry, I want to thank you for joining us and
Always great to be
keeping
with
us
you.
up to date. Stay right there.
Thanks, Steve.
One-on-one will continue right after this. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Sun National Bank, Qualcare Inc., New Jersey Manufacturers Insurance Group, PSE&G, Fedway Associates Inc., the Russell Berry Foundation, and by Cone Resnick. Promotional support provided by the Star Ledger and NJ.com, and by the New Jersey Business and Industry Association. Transportation provided by Airbrook Limousine. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.